Having a baby. For most women, it's a decision that comes with great thought and planning. And for many, the decision to stop having children leads some to opt for a form of permanent birth control called tubal ligation. But quite often, the desire to have another child appears when changes such as a second marriage or loss of a child occur.
Most women who've had a tubal ligation have been told by their physicians that it is not reversible. However, via microsurgery, approximately 90% of tubal ligations can be reversed successfully.
A tubal ligation reversal is an operation that affords a woman who has had a tubal ligation a chance at pregnancy again. It allows a woman the ability to conceive naturally with a very high success rate.
The success rate for patients undergoing tubal ligation reversal is in the order of about 70%. It varies on the type of tubal that was originally done on the patient. It also varies depending on the skill and experience of the surgeon performing the procedure. But in general, it should be approximately 70%, and that's actually better than most in vitro fertilization clinics.
I had a tubal ligation done, did some research because I wanted to start a new family and have my tubes reversed. I found Florida Fertility Institute and I contacted the office where the nurses there treated me like family. I had my tubes reversed and now I am pregnant.
Tubal ligation reversal is an outpatient surgery performed under general anesthesia through a small bikini incision. During the 1 to 2 hour operation, microsurgical techniques are used to open and reconnect the fallopian tube segments that remain after a tubal ligation procedure. Once the tubes are reconnected, the eggs can become fertilized and natural conception can occur. Recovery after the surgery is generally 2 to 4 hours, and the risk of the procedure is minimal. Most patients can return to work and other normal daily activities within 5 to 7 days following the surgery.
The tubal ligation reversal procedure has approximately 70% chance of pregnancy, whereas in vitro fertilization may have between 30 and 40% chance of pregnancy. The tubal ligation reversal is a much more natural way of conceiving, whereas IVF, the patients are required to take multiple injections over the course of several weeks. IVF, or in vitro fertilization, is also a one-time try, whereas tubal ligation reversal, since it is a more natural way of conceiving, couples can have more than one child if they so choose. After a tubal ligation reversal, the same rules of fertility apply. The age of the patient, ovulatory status, is there any male factor associated with anything, and overall health status of the patient.
Tubal Reversal Experts, located in Tampa Bay, Florida, is a nationally recognized center for tubal ligation reversals. All surgeries are performed at Bayfront Medical Center in nearby St. Petersburg, a private, not-for-profit hospital and leading healthcare provider for the Tampa Bay area and West Florida. Women come from throughout the U.S. and the world because of the nationally renowned team of tubal reversal experts. They combine medical and scientific expertise with individualized and compassionate patient care to help couples achieve their dream of having a family. Dr. Edward Zabella and Dr. Mark Sanchez are both board certified in obstetrics and gynecology and subspecialty certified in reproductive endocrinology and infertility.
It's our goal at the Florida Fertility Institute to help patients who've had a tubal ligation conceive naturally. Via microsurgery, we've helped patients from throughout the United States and throughout the world achieve their goal of having a family.
As renowned leaders in the field, the Florida Fertility Institute and tubal reversal experts are constantly looking at all new breakthrough scientific possibilities relating to fertility.
At the Florida Fertility Institute, we're dedicated to being on the cutting edge of the field of genetics and fertility. We're constantly looking at new breakthrough possibilities relating to fertility and advancing medical education in this field nationally.
At the Florida Fertility Institute, it's all about second chances.
I have an 11-year-old, and I met Boris, and we talked about having a little one, and I found Dr. Sanchez and Dr. Zabella. And I contacted the office, and I went in, had some tests done, and Boris came in and had some tests done too, and found out that it was indeed possible to have my tubes reversed. And I went and had the surgery, and this is what we got.
To learn more about tubal reversal experts, call 1-866-882-2573 or visit tubalreversalexperts.com.